Yes, we can hear you,
Thank
Professor.
you. Okay, okay.
Yes.
We have 40 minutes for this session. It is the start of curriculum 7 on crisis. I want to take 10 minutes from that and complete something about curriculum 5 that I did not finish, so that the curriculum is complete. I want to do it in the form of an exercise so that it is more interesting for you. Let's start. Let's do it together. Huh? Tell me, why do we keep records? All of you, please join in. Tell me, what are the reasons? Why do we have to keep records? Why should we keep records? If you tell me, I'm going to just enter it into the computer so that all of us can take a look at it. Tell me, why do you think we should keep records? Give me a good. Keep records? Questions? Do you need a file?
To review.
You can review. Yeah. You can review it, so you know whether the client is having some progress, whether he's having some difficulty. We know whether he had a relapse. We are able to review the progress. Thank you, Dr. Tin. What else? People, tell me something. Chat box, something. Why? What else? Why else should we do that? We want to see whether we want to review the client. What else?
Remind.
Loud. Can't hear you, madam.
Remind.
Hello.
It's that remind.
Pardon? It's remind you. Yeah. Yes. We want to, because as one of my gurus said, it's better than a long memory. So you are able to remind yourself. You see 10 clients in a day. So tomorrow when the client comes, you may not automatically, you will not automatically remember anything about the client. So you want to be able to note all the details of the client so that you will be able to give quality services, isn't it? Quality services. And also, yes.
Yes, not only for medical, legal, and the research purpose too.
Yes. That has become increasingly important now. Legally, that is a requirement. Client came in. It can be a client came in. He talked about attempting suicide. Then you contacted the family. You referred him to the crisis intervention clinic. You made sure he reached the place, etc. But the client decided not to get admitted. The family said, "We will take the responsibility," and they went away. The client committed suicide. Nobody can point to you and said you didn't provide care, because you have recorded it. You can prove that you did the right thing. The client came with a health problem, you provided medications, you provided nursing care, and yet something bad happened to the client. If it is recorded, that means you are able to protect yourself, protect your agency. You are able to protect also the reputation of your agency as an agency that provides good care. Just not recording those 2-3 lines can bring a lot of negative effects. I can see here that Dr. Ong has said that you want to use it to share these details with others. The client saw the doctor. The doctor has written that his BP is high, has been advised for a cardiac screening. As a counselor, I read that and I know what is happening with the client. So you wanted to share it with others, sometimes with your own team and sometimes with other agencies. What else? What else is in the chat box? You want to come back and read? Yes. For yourself also, you want to be able to review your own so that you are able to think about what happened to the client. You are able to discuss with the supervisor, and then you are able to plan better care, isn't it? Like suppose I'm an assistant doctor. I saw the client. This is what I noted. After that, when I see the senior doctor, I'm able to show and say, this is what happened. This is what I did. Is this okay? And when the senior doctor says, in my opinion, you should also do this. And then you are able to do better. So for your own, writing it down often helps you think about other options. You are able to use it for supervision. You are able to provide better care. What else? What else could be the reason? Hello? No other reason?
To prepare about next session or next talk.
Yes. So when you come for the next session, you're able to provide continuity of care, isn't it? Isn't it? You're able to continue with whatever you said. You told the client when you come next time, maintain this diary. You are using CBT. You said maintain this record and bring it back. So when he comes back the next time, you know what you asked him to do. You are able to continue. Also, sometimes because our own staff will change. You will next time you came, today you went away to attend your sister's wedding. Client comes. Your other counselor is there. She is able to take the record. She sees that he's come for his follow-up. She knows what issues to discuss with the client. So when the staff leave, staff are not available, etc., you're still able to provide services. Anything else, sir? Anything else, sir? Okay. So I would say that we've almost got all the important issues. It is also important from our, it could be a requirement of an agency, which could be receiving funding from somebody else. So often people who fund, etc., are interested in seeing what exactly was done. They want you to document everything. When the client came in, what services you provided, what the client did, what was the progress, every aspect of the treatment process, they want it to be in the file. The generally with records is that if you didn't write it, it did not happen. Client came with came very depressed. You addressed all this. You drew up a plan. You gave him the 24-hour hotline. Okay, that is done. If you didn't write it, people can say you didn't provide any care to the client. He just came, he didn't receive care. So from all these reasons, we do need to keep client records. Tell me, when I record, what are the issues that I keep in mind? I'm entering the record. Client came. What all should I write in the record? What is important? I'm writing. What all should I keep in mind? I pick up my pen. The client's file is there. I'm going to write. What should I keep in mind?
Your handwriting must be
Yes, yeah, your handwriting.
legible.
Yes, your handwriting should be legible. It should be clear so that anybody else can read. Doctors have a reputation for having a bad handwriting. They say only the pharmacist will understand the doctor's handwriting. But in the organization I worked for, the doctor's handwriting was very good. My boss had an awful handwriting. The only person in the institute who could read her handwriting was me and her computer operator. So we were very important people. Only we can make sense of what she writes. So when you write a record, you make sure you write it very clearly so that other people can read. Very good. Thank you, doctor. What else? What else? So you can write whatever you want very clearly. Yes, you can write the latest hip hop song. K music you can write in the record. What should you write?
I think we should record the patient's data and the various subheading
Yes.
so that it be organized and easy to follow.
Yes. So what you write? You write clearly what happened, isn't it? You will present the how the client was, what you did, what is the progress. The content of it is needs to be clear. Most follow-up notes are brief, written in a short way, but it should contain all the correct information. In a sense, we have to describe what happened. Nobody is interested in your opinion. I think the client is very anxious about taking up a new job. You in the record is not based on your opinion. It is based on facts. So you say client was wondering how he will get on with his new boss, whether his colleagues will be nice to him, whether he will be able to cope with the new work. Client expressed anxiety about all these three issues. And we decided that these are the coping strategies that he will use. The record should be clear. Also, make sure at any point of time, in most countries, clients can ask the court and get asked to see your records. So when they ask to see a record, make sure that the language you have used is very respect. Like you say that his mother acted in an idiotic manner. You can't write it there. You have to describe it. You have to say, even though it had been explained to the mother, she did give him another 2,000 bahts to handle the problem. You write it clearly without being judgmental, without using harsh words. What else is important? What else is important? Very important one. What is important? Is the date important? Is the sign important? Yes. So all this should be kept in mind when you maintain a record. The third thing what I to impress on is all our treatment centers have an admission criteria. We decide who we will treat or whom we will not treat. And when that happens, we should have a clear admission criteria written out. So we are clear whom we can provide help and whom we cannot. Can you think about your agency and see what kind of admission criteria you have in your agencies? Like in our organization, you may have a doctor, nurse, etc. But you won't be able to provide critical care. Suppose the client had a massive setback, you won't know what to deal with it. So if the client came, his ECG is erratic, his BP, you will prefer that he is sent to a specialized hospital which can respond immediately to a cardiac condition. So if he needs critical care, you may decide, I do not want to admit the client. Yes, sometimes his patient is actively suicidal. He's having thoughts about committing suicide. He wants to use his sarong over the fan and then hang. He's thinking about it. He made a attempt yesterday. Do you want to admit him in your addiction treatment center? Yes or no? Thailand, will you admit this client in your treatment center? He's actively suicidal, made an attempt yesterday. If your center has ability to keep him under 24-hour supervision, then you will admit him. Otherwise, if you don't have the adequate resources, your staff don't have the training to handle such a or prevent him from committing suicide, we are not going to be able to admit. So ask yourself what kind of criteria you maintain. Sometimes the criteria can be related to age. Your agency only treats adults or only adolescents, etc. In a SUD, we don't mix both adolescents and adults together generally. Some of your centers may only treat male patients. Female patients, you don't have the facility to deal with them. If you decide to admit female patients, you have to make sure the privacy, safety, etc. is provided. Sometimes you may be dependent on the amount of money he can pay. You cannot pay this amount of money. You do not want to treat the client. So sometimes it can be because of legal issues. If the client, you have to be responsible to make sure that he's in your custody all the time. The police want an undertaking like that, and you cannot provide that. Then you will not admit the client. You may have different criteria. Family should come and meet him every 15 days, or they should come for the family therapy program. So whatever it is in your organization, write up your admission criteria so that it is easy for everybody else concerned there. Anybody else, any questions to, any comments to make, or can we close? Guys, can we close? Okay, let's move on to crisis. I want to present the curriculum start. So, can you see the slide? Can you see the slide, madam?
Yes.
Okay.
Yes.
So in the 7th curriculum, we are going to define what is a crisis. We will talk about 20 guidelines that we have to keep in mind when we are trying to manage a crisis. We are going to discuss in detail about suicide intervention. What are the signs, direct signs, indirect signs, how do we respond, etc. We also will talk about how to handle difficult clients. We test a little amount of time on how to help counselors protect themselves and be safe. Because you can be an effective counselor or a physician only if you first protect yourself, both physically and mentally. This is what we'll discuss. Tell me, when I tell you the word crisis, what comes to your mind? I have two columns here. I'm going to write what the Myanmaris say here and what the Thailand people say here. I want one response from each of you. Tell me, when I say crisis, what comes to your mind? What thoughts come to your mind?
Your life, your
Okay.
health, your wealth.
Your life in the sense, life what? Life giving, life threatening. What comes to your mind,
can
Dr. Ankar?
be endangered. Sorry?
Yeah, life is endangered. Okay.
Yeah, somebody might attack you.
Okay. So it tends like, okay, it's like attacking. Somebody can attack. Okay. Somebody from Thailand, please. Oh, Dr. Chin, I didn't see the thing that you wrote about date and time. Dr. Abhishek, I didn't talk or see your summary. I'm sorry. I didn't see it. Okay, sorry guys. I've kept the chat box on now. So anybody wants to tell, they can tell. Yes, Thailand, tell me. When you say crisis, somebody says crisis. What do you think of?
Emergency. Emergency.
Pardon?
Emergency.
Emergency, yes. Very good. That means it is here now. Quickly you have to respond. Okay, so Dr. Tin says when he's thinking about emergency, he's thinking you have to think about yourself and others around you. Okay, very good. What else? Then you are saying that it is a not safe. Okay, what else come to your mind? What else comes to your mind when you say crisis? How does it feel? What feeling does it produce? I can't hear you. Huh? Threatening, yeah. Yeah. It's threatening, yes. What are the feelings comes to your mind? You feeling insecure? Yes. Yes. So we have a good idea about what crisis can do to us when something like this happens. Okay. Now let's move on to the curriculum. You'll find on your slide a thing which says, what is a crisis? This is a definition from a book. Crisis is a perception of an event or a situation. Perception means the way I look at it. I'm looking at a situation or an incident, or I am experiencing something. A crisis is something that can happen, involves me personally, or it can involve somebody else. Whether I am there or somebody else, it is a situation of intolerable difficulty. That means I am not able to manage the situation. Why am I not able to manage the situation? Because it is more than what it needs more resources than what I have. Let's take an example. Let's explain this further. So in this definition, it tells you what is a crisis. I am seeing it or I am experiencing. And it tells you the level of difficulty. Difficulty is too much. It is intolerable difficulty. And why is it a crisis? Because I lack the resources. I lack the ability to cope. That is what makes a crisis. Let's take an example. Flooding, I think, is quite common in the Asian countries. 10 days ago, there was a threat of a flood in my community. My friend's parents live alone. They're 80 and 90 plus. They were worried that the flood may come inside their house. Even movement will be difficult. So it's a very difficult situation. But when they knew that the floods were going to come, their son-in-law came, put them into the car. They locked up the house. The neighbors said, we will make sure your house is safe. And they went away to the daughter's house. They stayed there for 2-3 days. Somebody came and cleaned the house. After 2 days, the elderly couple came back to their house. Would it have led to a crisis? Yes. But since they had the resources to deal with the crisis, it did not become a crisis. So a crisis depends, it does involve difficulty. But if you have the resources and able to deal with that, you can. It is no longer a crisis. This is what, as treatment professionals, we need to recognize. Our clients with SUD face a lot of crisis. But if you as a counselor, you as a treatment center are able to provide good resources, are able to strengthen the coping mechanism of a client, then it will not become a crisis. It is a problem that came out, but the client was able to manage. So as a SUD professional, understanding what is a crisis, what causes a crisis, how to manage it, how to put safety guards in place so that it does not happen, etc., is part of our job. Any comments so far? Any comments? No,
Not yet,
thank
Professor.
you. Okay, thank you. Let's look at this. You will see on this slide 3 different points. Each of them talk about a different aspect of crisis. All the 3 are correct, but it focuses on a different viewpoint. When you talk about a crisis, you are talking about disorganization and confusion. Many things are happening. It is not order. It is not the same. It is very different from the normal. Normally in your treatment center, everything is organized. Everybody knows what to do, etc. But in a crisis, nobody knows what to do. People are screaming, people are getting tense, people are crying, people what to do, they're running here and there. So crisis is defined as a state of disorganization and confusion that a client will face when there is profound disruption. Something happens to his life. It was going normally, something disrupts it. So everything is going crazy. So from the client's point of view, there is a disruption and there is confusion. There is an incident and there is a reaction. These are 2 sides you keep in mind when you talk about crisis in a client. Let us take the next one. This is a very important point. Remember, crisis is always seen as a short-term period. Crisis is something that happens now, suddenly, and your response should be immediate, meaning response should be given very quickly. You should address it immediately. The faster we respond to a crisis, the lesser will be the damage. So remember, crisis is always defined based on the time period. The after effects of a crisis can continue for a long period of time, but the crisis is over. Let us assume one of our clients suddenly tripped and fell. He had a head injury. He's bleeding very badly. That's a crisis. So what do? If you have a well-planned approach, you know that immediately the doctor and nurse check, somebody calls for the ambulance, the client is carried very carefully, one of the staff goes him, takes him to the emergency care in the hospital. By the time you reach the hospital, we have already informed them that the patient is on the way, what to expect, etc. The client may take 10-20 days to recover. That is different. But the crisis was immediate. Short-term response is what characterizes a crisis. Because it is so immediate and it is a situation of lot of difficulty, it is normal to expect intense feelings, fear, uncertainty. You are worried that you may lose everything, a sense of loss, etc. So the third one talks about an emotional state in response to the situation. This is a beautiful aspect you have to remember. What they are saying is, any situation Just because a situation happens, it does not lead to a crisis. It is my emotional response to the situation that contributes to a crisis. Let's assume the client loses his job. Okay, the client can say, oh, this job is gone. I need to contact people and try to see how I can get a new job. That is one way of dealing with it. A client with no coping resources will say, I lost my job. Oh, I won't be able to find one. This is so embarrassing. This is so shameful. I think maybe it's better I finish my life. Nothing is working out for me, etc. So the situation can be the same. The situation does not lead to a crisis. It is the way that we respond to it, which again reiterates the fact that the person's resources and coping mechanisms have an important part to play. Okay, so if the problem can be solved by using my own resources, by taking the help of my family, my friends, my treatment center, then it will prevent it from become a crisis. If it is an issue that I can deal with, even if it is a big problem, it is not a crisis. Let us look at this slide. This slide, for very often people made a mistake. They said that that the crisis, the Chinese word for crisis, which means danger, was very similar to the Chinese word for opportunity. It is not true. As your slide can show you, the lettering in some of it is similar, but it is not the same. But it presents a very important message. A crisis can lead me to danger. As all of you said in that exercise, you said it is life-threatening. It could be you're afraid, etc. So on one hand, crisis can lead to a dangerous situation to the client in recovery. He may, so much so, he may have a relapse. He may decide to commit suicide. He may decide to abandon the family and just go away and live on the streets. A crisis can lead to danger, true. But a crisis can also be an opportunity that readies the client to receive an intervention. Many clients seek SUD treatment only after a crisis. Wife leaves him. He had an accident. He heard news that his close friend, his drinking buddy, died yesterday, leaving behind his young wife and a 3-year-old son. That shocks him. He realizes that continuing to use drugs or alcohol may mean an end of life for him also. So often a crisis can open up the client, can ready the client to seek treatment. Very often smokers decide to quit smoking after the first heart attack. Very often a crisis plants the seed for change. It makes you want to create a change in your life. Is this clear?
Yes, Professor.
Thank you, Dr. Ong. Thank you, madam. Okay. Now I want to do an exercise. This is supposed to be a small group exercise, but I want to do it in a large group. I want to discuss how a crisis can be a danger. I want you to give examples for that. I want you also to say how crisis can be an opportunity for change, for growth, for a new beginning, etc. I have this on my slide here. I want you to give examples. If the Thai people want to talk to each other start a discussion there. One of you can call out loudly on the speaker and I can write it here. Myanmar is you are comfortable with calling it out or using the chat. Either way is okay for me. I have the chat box open now, so you can start entering if you want to. Tell me examples where crisis can lead to a danger, especially for our SUD clients. If you have other examples, also fine. Crisis is causing danger. Tell me some crisis that can lead to a danger.
Professor, do you mean the examples or scenarios?
Yes, I'm looking for examples and scenarios. Yes, doctor.
Okay, Professor.
Dr. Thiru, we cannot hear you, actually, right? What about others?
Yeah, I think he is remaining silent. I thought.
Yeah.
Can you hear me now?
Yes,
yeah,
now we
yeah.
can hear
Oh,
you.
oh God, I must have pressed the button by mistake. Okay. So sometimes a danger can lead to a opportunity. Wife is suing for divorce. He may decide to go for treatment. That means it creates an opportunity for growth. Because of a relapse, he may lose everything. Because of that, his motivation to quit drinking may become very, and he can recover very beautifully. An OD for heroin, he almost died. It reminds him how life is so precious. So he wants to come out, help other people, live on a truly Buddhist or a truly as a true Christian, etc. So I'm just saying that crisis can lead to danger. It can also lead to an opportunity. Okay, I sign off here. I think your other person who has to take over must be somewhere here. Have they joined? I'm supposed to stop now. So what I was trying to say is crisis is short term, lot of difficulty, but depends on resources. You'll be able to manage it well or not. Okay. Goodbye, guys. See you later.